Hi, my name is Jennifer. I've been a registered dental assistant for about 12 years now. The first time I heard about Isolite, I was actually at a convention show, and I saw on the floor they had a couple of patients that they were trying it out on, so I was interested from there. It was actually somebody pouring an entire bottle of water into the patient's mouth right there on the floor, and without them having the main suction lines that I would imagine they would need, they were able to evacuate all the water. I was really excited when the Isolite finally arrived in the office. We had talked about it for a long time. I kept hoping that it would actually come, and so it was my surprise on a Monday morning to see that it was there next to my regular suction lines. When I first tried to use Isolite for the first time, I was a little bit intimidated by the mouthpiece. I thought that it would be really difficult to fit it in, but once I folded it as the directions instructed me to do, it seemed to slip in fairly easily. I think there's a little bit of a learning curve just talking about what the device can do. It has so many benefits that I didn't want it to sound like I was trying to sell a patient on all the things that they could do, so trying to customize it to what would work best for them in their mouth. I really appreciate the Isolite when I'm working on my own. I don't have an assistant for myself, and I already need an extra set of hands when I'm assisting a doctor, so I really appreciate it, especially if I'm by myself. A procedure that I've done with Isolite that's really helpful working by myself is doing a sealant procedure. If you have to retract and suction and you're trying to pack cotton rolls in, the isolation is so important, and not having an extra set of hands can make the procedure take a lot longer. So the Isolite is really handy to make it go faster than it would, even if I did have a second set of hands. I think there's a little bit of the fear that Isolite would take your job away, and you think, oh, you hear about it, you just suction for you, and well, then what do the doctors need me for? But there's a lot of other things that you can do, that you can be passing other instruments and other materials that I usually have hanging off of my pinky that I can actually hand properly without worrying about stabbing the dentist along the way. So. I think the response from patients to the Isolite has been really positive. I think when they first look at it, they look at this wacky utensil and think, what is this going to do? But once they kind of see the benefits and that they can relax, they don't have to concentrate on staying open, they don't have to constantly swallow or worry you're not going to get the suction in there fast enough, that they're really happy to just relax. There's a little bit of a learning curve to the sizing. I've kind of found that most people fall into medium category. There is a guideline that if they can open their mouth 2 fingers wide, that they're a small, or 3 fingers wide, that they're a medium. But sometimes patients surprise you. You just get a feel for it as you go. Sometimes you think that someone has a really large mouth and they have a smaller opening, but that's why we have the multiple sizes. You can always switch out if you need to. So we've been using the Isolite for about 2 months now, and I really enjoy using it. I think it really helps with the efficiency of all the procedures. I feel like the patients are more comfortable. It certainly frees me up to do other things. I don't have to worry just about suctioning. At first, some of the patients were a little bit leery of the system. They thought it looked a little weird, but once it was in their mouth, I think that they saw the benefits of having constant suction, so they could kind of take that worry out of their mind that they weren't going to be drowning. And I can focus on doing additional suction if I need to for extra debris, but I'm able to pass more instruments and materials rather than just focusing on suctioning, so it definitely helps the dentist be more efficient in the work that he's trying to do. I think the ergonomics of the Isolite are really helpful. I feel like I'm not twisting as much. I can stay in the position more readily. I don't have to worry about getting every drop of saliva because the Isolite is doing that for me. So I can just stay focused in one direction, getting debris from a specific tooth rather than going into every corner of the mouth and having to move my chair around as much. I think the Isolite has definitely helped speed up our procedures, specifically when we're doing several posterior composites. Usually we would have to fill them individually just because isolation is such a problem, but with the Isolite we can continue running the suction and do several fillings all at the same time, so it definitely helps us get the appointments done faster. So we've been using the Isolite also for CAD/CAM scanning in the mouth. It definitely helps our scanning be more effective. We can do an upper and lower scan at the same time without saliva invading the area. Usually we would have to do an upper and a lower scan separately, but now our scans are more accurate because the field stays dry. I've been really surprised at how the Isolite has helped with sealants especially. I didn't realize that isolation is always a problem, but I also didn't realize how much it was helpful for retraction. And so if I'm working by myself, I actually can work by myself. I don't feel like I need to have a second set of hands, because the Isolite also helps with the retraction part of it. And you don't have to do an individual sealant. You can do multiple sealants in an arch at a time. The Isolite has been helpful if we're doing any kind of amalgam removal. Patients are always concerned about vapors coming off when the amalgam is being removed, and
mercury poisoning, that type of thing. So the Isolite has been helpful to continue with suction back there, and then I can focus on getting some of the larger debris bits so the patients are more comfortable feeling like they're not ingesting anything. The Isolite has definitely made my life easier. I'm using it for every procedure that I can. I feel like it makes the procedures go more efficiently, the patients are more comfortable, and Dr. Rohde is happier that the procedures are going more smoothly.